Good morning, ladies and gentlemen. Welcome to Rainmakers Roundup. I am your host, Mark Iorio, and I am with the Stonekings, the rock band, the Stonekings, right? No, I'm sorry. You guys are physical therapists and wellness in Ewing?
Yep.
West Trenton?
Yep.
Right?
Yes.
Good to have you guys.
Our 30th year.
30th year.
Yeah.
Good to see you, Rich.
Thanks
Good
for
to see
having
you,
us, Mark.
Brandon.
Thank you.
Great to have you guys. I am so happy you guys are here. I think a lot of people think of physical therapy, right, and wellness as different things. It's not the same thing. But I want you to explain what the differences are and what, as you get older and we age and we need sort of physical therapy on certain things. What are the subtle differences between those things?
Well,
go ahead. Physical rehab too, Rich.
Yeah, well, first of all, physical therapy is a licensed profession, like being a lawyer, a dentist, a doctor.
Mm-hmm.
We have our own ethical, moral obligations, laws, and so forth that we have to follow.
Mm-hmm.
But physical therapists, I like to look at physical therapy as a profession that's a non-drug, non-surgical approach to health and wellness. We don't operate, we don't prescribe drugs, and we really look at improving someone's function. I think that's key to what we do. People usually come to us with problems that are impacting their function, might be pain, might be post-surgical problems with lack of range of motion and strength. But basically, the people are coming to us because they've lost something. It might be balance,
right?
And we're looking to get them back to being a whole person. And generally, we like to empower them to help themselves. That's
excellent.
In a nutshell, that's.
Yeah. Now, Brandon, you have a doctorate in physical therapy, right?
Mm-hmm. Yes.
What's the difference between you and what your dad went through 30 some years
40
ago?
years ago.
40 years ago.
So when he was in school for physical therapy, there wasn't the option of a doctoral degree. So in recent years, probably within the last 10 to 15 years, most of the programs have moved over from the master's degree to the doctoral degree.
Okay.
It's a lot more extensive education. There's a lot more evidence-based practice and research that we go into. It also allows us for direct care, direct access, so that you don't have to go to your primary care physician or your orthopedist. You can come right into a physical therapist.
Okay.
You can walk in right off the street.
Okay.
It kind of eliminates that extra step that you have to go to.
Okay, so for those who are watching, you don't need a referral to go to Stoneking Physical Therapy and Wellness, right?
No.
You just come right in.
Correct.
Which is nice, because it kind of a lot of people, they don't want to have to go through the whole thing of going to see the primary and the ortho. Now you have that ache or pain. Maybe you want to get checked out, maybe not. Get it checked out. Come on in. It doesn't,
Right.
And
Do you both think that you have a different approach, or what makes what Stoneking does a little bit different than some of the other physical therapy and wellness centers out there?
Well, my philosophy has always been that the physical therapist works one-on-one with the patient.
Yeah.
So we try not to use extenders of care. Today sometimes you'll go into a doctor's office and you'll see the PA, you'll see the nurse practitioner, you won't see the primary.
Mm-hmm.
Physical therapy, there's aides and physical therapist assistants that sometimes you'll see the PT, get evaluated, and you get transferred over. That we have not ascribed to that method of treatment. It's one-on-one for continuity of care. It puts the patient at ease. So that's been our biggest, no use of extenders of care.
I think it's also good because his level of experience and what has worked for him over the years is a little bit different than what I learned in school.
Yeah.
So, we were kind of always bouncing ideas off of each other, like what has worked for him and what I kind of learned. So I'm bringing in some new ideas also. So it kind of works well, together.
Absolutely.
Are you dad in the office, or is
He's dad in the office? Yeah, he is.
All right.
Hey, Dad, what do you think about this? I thought about that for a while. It was a little weird.
Yeah, I didn't know what to.
How are people going to perceive this?
I like it. I like it.
Yeah.
Dad is dad. You
Dad's
you
dad.
never be different. Right?
Doesn't feel right calling him Richard or.
Yeah, right. No, don't.
Too distant.
Yeah.
So tell us a little bit about the services that Stoneking Physical Therapy and Wellness provides.
Well, I mean, we kind of run the gamut. We start with, younger athletes, your 12 years old and up usually, high school, college athletes, all the way up to your older geriatric populations. We see a lot of post-operative patients. They might come in after a hip replacement, a knee replacement, whatever it may be. We'll see people, you just come in with a neck or back pain, shoulder pain, anything. We like to really, kind of provide a broad range of services.
Right.
We'll see neurological issues, post-stroke, Parkinson's, MS, any of those kinds of things.
I would also add that it's not just general health population, it's also people injured on the job, so it's the workers' compensation population, trying to get
Okay.
people back to their former level that their employer requires of them, and motor vehicle accidents to a limited degree, people injured traumatically that way.
Sure.
So it's a broad spectrum.
There seems to be a lot of advances, especially you mentioned, Brandon, you mentioned Parkinson's, and we have some friends who have Parkinson's, and I was reading recently where like boxing is helping Parkinson's patients, and I could never put my finger on why, but I'm thinking that the dexterity, the movement of the feet and the hands and everything are really helping them neurologically. Is that right?
There's some pretty interesting cutting edge concepts on helping that patient population.
Yeah.
One of the big issues is sometimes the difficulty getting up from a chair.
Yeah.
Or performing a motion
Sure.
voluntarily. There's also something called loud, where you actually, maybe as I'm trying to get up out of the chair, I shout a word very loudly. And it's interesting, the concept of how it works, but the person's able to stand up.
Wow.
Yeah, I mean,
Yeah.
these little treatment
Big
techniques.
and Loud
is-
program, yeah.
Yeah, that's wonderful. Tell me something. How do you find new patients? What is your approach to finding new patients? Is it word of mouth? Are you doing? You obviously have website, etc.
Well, Brandon stands out on the corner and he flags them in.
Yeah, I dress up,
Put banana peels down.
Yeah,
SpongeBob SquarePants sitting out there flagging
yeah,
people
exactly.
down.
I think 30 years of being in the community
Sure.
helps a lot. The
Yeah.
marketing, the word of mouth is huge. Good reputation,
Yeah.
good patient satisfaction goes, be honest with you, you don't have to market so hard that way, but there's a lot of competition, so we make sure that we go the extra mile and let them know we appreciate
Yeah.
them seeking us in this competitive environment.
Yeah, and we're active on social media, the Facebook, Instagram is kind of the way of the world now, everybody's moving over towards that kind of marketing
Yeah.
and stuff.
But reputation's huge. I mean, it's
Absolutely.
really a big thing. I mean, you've been in the community forever. I mean, you
So
grew
I
up
grew
here.
up.
You grew up in Ewing. You went to high school at Ewing. And right, people remember that name, and thank God for that, right?
Yeah, it
Thanks.
also helps to have a last name like Stoneking.
Yeah, exactly. No one can forget that.
You go to the phone book, you see one.
Yeah, right. One. Tell me something. I know you've worked a lot. We're not going to talk about individual patients, but it's always fun and interesting and gratifying to hear about a patient that came in and they really struggled, really had a tough time walking or moving their arm or something. And I just want you to talk about a case study or a success story that you feel really good about.
Sure. I had a gentleman who came in. He had just turned 70 years old, and throughout his life, he's always been very active. He was a runner, and he's run over 50 marathons in his lifetime.
Wow.
And he came in. He could hardly walk. He was suffering from a significant hip injury, and all he wanted to do was run one last marathon. He wanted to run the New York City Marathon. So he came in, and I was like, well, what are you up to now? He's like, I can run 2-3 miles maybe, and that's about it. I have to stop. I can't run any further. And so over the course of a couple months, we were able to get him back, just doing some different exercises, some stretching, and he was able to complete the marathon. He came in, and he had his medal on. He brought me a bottle of wine.
Wow.
Couldn't have been happier, and it was just pretty cool, to be able to.
Oh, that's a
to give
great
him
story.
that,
That's a really great story. What were some of the symptoms that he was dealing with prior
I mean,
to?
just just pain and weakness within that hip.
Yeah.
That summer he had been running on the beach, I guess, in some soft sand, and had injured his hip.
Yeah.
So yeah, it was really pretty debilitating for him.
And some of those muscles in your hip are really short and they're hard to get at, right?
Yeah.
They're really difficult.
Yeah,
the
yeah,
hip
the hips-
flexor muscle or something like
Yeah.
that is really.
And someone like him, this individual, sometimes you have to protect people from themselves, and there's the overuse syndrome.
Yes.
He's the type A, run through the pain type deal.
Oh yeah.
And marathoners run through pain.
Right,
You know that.
yeah.
But he was chronically re-injuring himself.
Yeah.
Right.
I just would add that I think every day is a success with people. You get complimented every day. It's an
Yeah.
ego boost. You
Yeah,
know,
I'll bet it is.
You celebrate the little successes. You know, you can get rid of the walker and go to the cane now.
Yeah,
And
absolutely.
That's huge.
Yeah.
You know.
I'll bet it is. So as we age, and I feel this. I don't know why. I'm starting to feel like every morning. This morning I woke up, both knees were killing me. I'm standing in the shower and I'm thinking to myself, what's going on? Why am I feeling this pain? And we're going to take a break, right? But when we come back, I want you to talk about some tips or recommendations that you have for some of the people, the audience out there, on how to avoid things like that, or maybe prevent that, or maybe even see Stoneking Physical Therapy and Wellness to come by and fix those problems.
Sure.
We're going to come back right after a message from our sponsors.
Dogs aren't broken. They've simply experienced more life. If they were human, we would call them wise. They would be the ones with tales to tell and stories to write. The ones dealt a bad hand who responded with courage. Do not pity a shelter dog. Adopt one.
Say we've got grit, and we'll take it as a compliment. Because it's our uncommon drive, our spark within, that brings us together and sets us apart. We are temple made. And when others take shortcuts, when others take breaks, when others take the easy way, we take charge.
I work 13 hours a day, 6 days a week. So when I'm off the clock, I gotta get stuff done. So when I need a snack, I need something healthy, tasty, and easy to eat. Like wonderful pistachios without the shells. They're protein-powered, delicious, and great on the go. And that's perfect for me. Thanks, Liz. A woman without a lot of time.
Welcome back to Rainmakers Roundup. We were just watching the Stone Kings on the commercial break here, and wow, that was very impressive. That's your facility in West Trenton, right on the corner of Scotch Road and Parkway Avenue, right?
Correct.
Yeah.
Correct.
Yeah, that was really impressive. You have a lot of equipment there, and you could see how you're caring for people individually.
Yeah.
That's wonderful. That's wonderful. Before the break, we were talking about, during the break, we were talking about aches and pains. You don't have any, do you?
No, not many. You watch me walk?
Yeah.
I'm not immune.
Yeah, I'll bet not. I'll bet not. But I as we age, I think it's just, I don't want to say it's inevitable, because it doesn't seem like it should be.
Right.
But, different aches and pains that just creep up now and again. And if you are an athlete and you're working out on a regular basis, you're using those joints and muscles and ligaments and tendons constantly. So I guess there's going to be some, wear and tear, right? So what recommendations and advice, I guess, or tips, not advice, but more tips can you give to people who are experiencing that?
I mean, I would say that the best thing you could say is, it's an ounce of prevention. You really want to take care of yourself throughout the course of your life. Sometimes people will kind of let themselves get to a point where, they haven't exercised or they haven't been eating correctly for long periods of time, and now they're suffering, low back pain or the residual effects of that, the knee pain and the arthritis. And so just taking care of yourself throughout your life can really prevent yourself from incurring a lot of these injuries. Athletes, it's a whole different animal. You're doing a lot of, ballistic movements that might put a lot of strain on certain parts of your body. If you're a pitcher or you're a baseball player, you're going to suffer and incur some of these injuries. And maybe you suffer an injury when you're younger in your life that doesn't really, show itself until you are older. And start to get those aches and pains. Yeah. But feeling pain is not normal. So you shouldn't just accept that that's a part of aging. It's not. There's things that can be done. So you don't have to feel like you have to live with something for the rest of your life. There are options. There is physical therapy. So don't feel like that's just normal part of aging.
And we talk about movement as being one of the biggest things. We're 600 muscles constructed for movement. But we find that it's a deleterious effect to be sedentary for long periods of time in your life. And today, a lot of people fixed on the computer. Yep. The consequences of that are probably very severe for your neck and back, let alone you're not moving and burning calories, so obesity creeps in there. Yeah. That was the idea for our wellness center. We developed a medically oriented gym, principally for, I say, the baby boomers and their parents, the older adults that would be people who would walk in that would have lots of medical conditions that we should be concerned about before walking into a standard gym. You might have high blood pressure. You might have multiple risk factors. Well, ourselves as physical therapists and our exercise physiologists will design an exercise program personal to you and all your health conditions. Maybe your arthritic knees. You might not be doing seated leg extensions on a leg machine. That's probably an inappropriate exercise for that condition. So we tailor specifically to you rather than the generic walk in the gym with a bunch of people with the earbuds in, nobody talking to each other.
Right, exactly. Yeah. The other thing that I see often, and we see it all the time as consumers, is if you have, as Brandon pointed out a minute ago, everyone, pain is not normal. So the first thing that people think of is, well, I'll take an Aleve, or I'll take an ibuprofen, or I'll take something that will mask the pain, right? And it'll go away. It's not going to go away. It's just going to be masked, right?
Right. Correct. And if you don't respect your kidney or liver, then you keep taking those things. But, we try to take that non-drug approach in helping you get through. Education is big, and educating you why you may feel the way you do and what you can do about it. Helping yourself.
And one of the main objectives for this year by the APTA was to try and get an education out there for people on non-opioids, like not going for that pain pill if you're feeling something,
Absolutely,
going to physical therapy first, because I think we're all aware that there is a little bit of a crisis in this country with opioids,
absolutely,
and how physical therapy is really a better option, you
Yeah.
know, for those people.
But it's all about education, because a lot of times, you know, when you start to look at, you know, people think that they can go to the internet and say, oh, you know I've got a pain in my left knee, I'm going to go fix that.
Right.
That's not the way to do it. I
Right.
mean, you have to come to,
Well, we'll give you the roadmap.
right,
We'll give
exactly.
you the map. You
yeah.
follow the map, you'll get to your goal.
Yeah,
You don't follow the map,
Right.
maybe you'll go off.
And maybe it's not physical therapy. Maybe, you know, we do see something that we don't, you know, surgeons have a job for a reason.
Absolutely,
Maybe
yeah.
something would require surgery, so we
Yeah.
would send you in that right
Yeah.
direction, you know?
You know, I love the father-son thing. You know, family is so meaningful to me, and I'm sure to you guys. Why did you follow in your dad's footsteps? What caused you to do do that?
Well, I mean,
Other than he's a great guy and
Well, I mean,
a smart
of
guy.
course.
That.
yeah.
Cut.
I kind of always had an interest in sports and also science, and so it kind of really married the two, physical therapy.
Yeah.
And you know, growing up and seeing how much enjoyment he got out of it. I remember going in as a kid to the office and just seeing all that. And you know, it wasn't always my first thing in my mind. I wasn't always sure what I wanted to do. But
Right.
as I went through school, I thought that it might be, you know, really a pretty cool opportunity. You know, and I like to hang out with people. You know, you get to see all different people all the time.
Plus, get to see your dad every
Yeah,
day.
yeah. Well, yeah.
You were studying to be a doctor at Penn, right? And
Yeah.
what happened with you? What caused you to take that pathway toward physical therapy?
Third year of college, and I'm a biochemistry pre-med major, and I'm thinking medical school, and I was sitting on the bench on campus, and I met a upperclassman who was in the physical therapy program. I knew nothing about physical therapy, never experienced it. He told me a little bit about it. I was intrigued by that non-drug, non-surgical approach. Talked to the dean of the school. My grades were good, and she said, you know, it's going to take an extra year or two to go through the program in addition to your current major. So my thought was, I'll give physical therapy a try. I did my residencies, which I enjoyed very much. They offered me a job out in the University of Washington Hospital in Seattle, working with spinal cord injured patients.
Wow.
And I never looked back. It was going to be fallback plan. I'd go back maybe to medical school if I didn't like it. I've never regretted it.
Yeah.
For 1 minute. Matter of
Yeah.
fact, I feel very fortunate to be able to do what I do.
Yeah. Hey, clear something up for me if you don't mind. What's the difference between a physical therapist and an osteopath? Is that an easy answer, or is that a long?
It's an easy
And it's an
answer.
easy answer. Okay.
It's like saying, what's the difference between an MD and a physical therapist? It's a medical school education in osteopathy as opposed to general medicine, but they can prescribe and they can inject.
They can.
Yes.
Okay.
They can prescribe and inject, and you know, osteopathic there's oftentimes thinking about also chiropractic.
Right.
Because osteopaths learn how to do manipulation as well.
Okay.
So manipulation is part of their practice.
Right.
The hands-on care.
In the Stoneking practice, is there a chiropractic element to it as well?
Yeah, we do a lot of hands-on care. You know,
Okay.
it's a hands-on profession. You know,
Yeah.
we're doing, you know, a lot of we'll do some massage, and it's not massage therapist.
No,
it's not doing my
yeah.
thing, but we do you know, the joint mobilizations, and it's a lot of it is hands-on.
We may call it manual therapy.
Manual
as opposed
therapy.
To manipulation, but it's
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 similar.
using your hands to
Got
do
it.
Yeah, absolutely.
Okay. So tell me something. Over the years, who has inspired you to do what you're doing?
Well, I think I draw the inspiration from my patients
Yeah.
and the satisfaction they derive. I'm inspired by my family and their support.
Yeah.
Starting out 30 years ago in private practice was like a shock to my wife. I came home one day and said, I've hit the glass ceiling where I am. I'm not going any further in this place of employment. I had this drive with having 2 children
Yep.
to be my own boss
Yep.
and take my own risks, and the inspiration and their support. I mean, my wife is the business manager, if you want to say. She's not in the office. She does everything other than billing and collection.
Remotely.
And having her do that, you
Yeah.
know, and handle the finances is critical.
That's critical.
Yeah.
Yeah. Yeah. How about you? When you look back, Brandon, besides your dad, I mean, the inspiration for doing what you do. I mean, we're in Rotary together. right? We're in the Trenton Rotary Club together, and it's all about service above self. So we care about other people.
Right.
And you've got a really cool background too. I mean,
Yeah.
So
It's I don't know. It's just like he said, the patients and the people that you get to help. You know, just seeing that person who's, you know, gone through some kind of a traumatic experience. You know, they might have had a life-altering injury or something, and getting them back to, you know, a level of function that they prior level of independence that they had. You know, taking that person out of that wheelchair and getting them up and walking, or whatever it might be, some small success that you're able to give people. So being able to do that on a daily basis, like I'm a fairly extroverted person, so I like to, you know, interact and goof around with people. And, so it's a fun job. You know, a lot of times, a lot of it's humor. You know, that helps these people. Right?
Well, it has to be, right? You've got to have fun while you're doing it.
I've got a lot of bad jokes, I've been told.
Yeah.
I want to make someone laugh.
Any that you could tell on the set? No, I didn't think so. But so, you know, it's been a great 30 minutes. I really appreciate the time and energy and effort and what you've accomplished over the last 30 years, Rich. And Brandon, following your dad's footsteps has been pretty remarkable.
Yeah, thank you.
The Stoneking name out there is great. You said earlier too, Rich, that you had a fairly large facility up in Lambertville that you sold off to Hunterdon Medical, and I'm sure running 2 locations like that was not easy.
No, the idea was I needed to simplify a little bit.
Yeah,
it was the timing was right.
Right, exactly. So, well, listen, gentlemen, this has been a great 30 minutes. I really appreciate your time.
Thank you, Mark. Appreciate it.
Brandon, thanks, Rich. Could you look into that camera right there and tell us how to get in touch with Stoneking Physical Therapy and Wellness?
Go for it.
So in order to get in touch with us, you can give us a call. It's 609-883-7528, or you can look us up at stonekingptwellness.com.
Wonderful. All right.
Good.
Thanks, gentlemen.
Thanks.
Thank you, Mark.
All right, ladies and gentlemen, that's a wrap for Rainmakers Roundup. You have a wonderful and safe week, everyone, and we'll see you next week, same time.